Sanjeev Ramdeo, Program Manager for IHP. I've been working with JR, he's the lead. And before we wanted to get into the justice involved, we kind of wanted to put some contextualization as to why it's important in the larger framework of what CalAIM is. Next slide. All right, so what is CalAIM? California Advancing and Innovating Medi-Cal is a long-term commitment to transform and strengthen Medi-Cal, offering Californians a more equitable, coordinated, and person-centered approach to maximizing their health and life trajectories. So in the simplest terms is adding additional infrastructure to our existing Medi-Cal programs. And the goal by doing this is by implementing a more whole person care approach and addressing social determinants of health. And by that, we're hoping to improve quality outcomes, reducing health disparities, and driving more delivery system transformation and efficiencies. Next slide. So these are the initiatives of CalAIM. It's categorized by color code, and I'll just go over the color code really quickly. The orange are funding opportunities for providers. The blue are new benefits and resources for members. The key statewide requirement programs are the ones in yellow, justice involved being one of the major ones. And then the green are statewide frameworks. And I'll go over the initiatives really quickly by title and a little bit about each. But the Behavioral Health Initiative is a strengthening the behavioral health and mental health, substance and use disorder services, and integrating them with physical health care. So there's a link between those two. Community supports, which historically was in lieu of services, but we're adding additional social determinants of health services to address those types of needs based on populations of focuses. And then we have dental initiatives, enhanced care management, which is what we'll talk about today. We have incentive payment programs, which is Medi-Cal supporting implementation, expansion of ECM community supports and other initiatives by providing incentives to Medi-Cal managed care plans to invest in improving quality of care. So more infrastructure payments and incentives. Integrated care for dual eligible members, justice involved reentry, which is the impetus of this meeting, population health management, providing access and transforming health, that's our path funding, statewide managed long-term care, and supporting health and opportunity for children and families. Next slide. Okay, so CalAIM Enhanced Care Management, ECM. Managed care plans, this is what our responsibility is. ECM is a statewide Medi-Cal benefit available to eligible members with complex needs, and the eligible members will see they're broken down into different populations of focus. So the access to single lead care manager who provides comprehensive care management in coordination with health and health-related care and services. The challenge that we are trying to solve by implementing ECM benefits is that Medi-Cal members typically have several complex health conditions involving physical, behavioral, and social needs. Members with complex needs must often engage in multiple different delivery systems, and they all have their own way of operationalizing things to access care, including primary and specialty care, dental, mental health, substance abuse, so on and so forth. The biggest challenge that we're trying to overcome is that Medi-Cal spending is attributed to 5% of the members with highest cost needs. And the goal is that we're able to address the overutilization by connecting them with the social determinants of needs, a program like community supports, housing, and so on. Lastly, to streamline these services and reduce overutilization, DHCS implemented ECM as statewide. Sorry, my dog is going crazy in the background if you hear that. The statewide Medi-Cal benefit available to select members with complex needs based on the populations of focus. Enrolled members receive comprehensive care management from a single lead care manager who coordinates all their health and health-related needs. ECM makes it easier for members to get the right care at the right time in the right setting, hopefully because we have data sharing strategies to make it more seamless, the information that we need to enact certain things for benefits. and receive comprehensive care that goes beyond the doctor's office or hospital. Next slide, please. Okay, so ECM is broken down into 7 ECM core services, and as you can see, it's outreach and engagement, comprehensive assessment and care management plan, enhanced coordination of care, health promotion, comprehensive transitional care, member and family support, coordination of referral to community and social supports. And you can see the populations of focus broken down into adults, children, and youth. I can go through them if you want. Individuals experiencing homelessness. These are each of these populations of focus. If a member is eligible, they become ECM enrolled or ECM eligible. Individuals at risk for avoidable hospital or ED utilization. Individuals with serious mental health and or SUD needs. Individuals transitioning from incarceration. Adults in the community at risk for LTC institutionalization. Adult nursing facility resident transitioning to the community, children and youth enrolled in CCS or CCS, WCM, and additional needs beyond the CCS condition, children and youth involved in child welfare, birth equity population focus. Next slide.
I can jump in on this one if you want me to.
Sure.
This is Ati Anderson. I apologize for not being on camera. I am actually physically at Disneyland today. So I want to talk a little bit about community support. So in addition to ECM, we also have 14 community supports, soon to be 15, that we offer as part of all of the managed care plans. And they're statewide services that are provided that are essentially in lieu of other higher cost healthcare. So there's 3 that we refer to as the housing trio. That's housing transition navigation, housing deposits, and housing tenancy and sustaining services. And these are it's kind of a continuum of care. So typically we see people sign up for housing transition navigation first, and then they really get comprehensive services, a housing transition navigator to really find and stabilize housing. Once they find a unit, they may be eligible to receive housing deposits. So that security deposit and those initial setup costs of establishing a new residence for someone experiencing homelessness. And then once they've established a residence and they need kind of the help to maintain stability, they would be eligible for housing tenancy and sustaining services. So that really helps them get ready to pay rent on time and get used to having a more stable housing situation. In addition to this housing trio, in January of 2026, transitional rent will be going live, which it offers up to 6 months of rental assistance for members, particularly in a behavioral health population of focus. But that we're really excited about that. That will be coming live soon. So then there are 2 additional somewhat housing related. So short-term post-hospitalization housing and recuperative care, both of those provide respite for those who would otherwise potentially be experiencing homelessness. Short-term post-hospitalization housing is for those who are exiting some kind of an institutional setting. So that could be a hospital, but it could be incarceration as well. And both of those, you may receive up to 6 months within a 12-month rolling period. And that's combined across transitional rent, short-term post-hospitalization housing, and recuperative care. But they're really amazing resources for our members who are really most in need. We also offer day habilitation, which is kind of classes to really life skills classes, essentially. Caregiver respite, so for members who have a caregiver, we know that sometimes that caregiver needs to take care of their own needs, and so we offer respite services for them. Personal care and homemaker services, this is what's supplemental to IHSS. Someone actually just need to have applied for IHSS, but they may have additional needs like to fill a gap, or they need more hours that haven't yet been approved, or they're waiting for their IHSS to come through. Personal care and homemaker services would help with that. Nursing facility transition and diversion to either assisted living or nursing facility diversion to home. These are for people who are in a skilled nursing facility who may want to transition either into a home setting or into an assisted living setting, and we assist with that. Environmental accessibility adaptations are also called home modifications, and those are for people who need like a grab bar or something that to adapt their physical location where they are to be able to maintain independence in the community. Medically tailored meals are for folks who have a significant chronic condition that is nutritionally sensitive. So someone with uncontrolled diabetes, someone with uncontrolled congestive heart failure, for example, they may be eligible for medically tailored meals to be able to support their health. Sobering centers are available for anyone who is actively intoxicated. They are a place to go to sober up essentially and get resources. And then asthma remediation, similar to home modifications, is to help with when someone has uncontrolled asthma, to be able to go into the home, look and see what the triggers are, and see if there are adaptations that can be made to help fix their asthma issue. I'm sorry, I didn't hear that.
I think
that's all community supports.
It was just background noise.
Okay, great. Okay, so that's community supports. Happy to answer questions. I'm gonna hand it back over. We can go to the next slide.
Thank you, Asya. Okay, Sanjeev, you want to take it back over?
Actually, Dr. Anna, I think this might be Amy, right?
Thanks, JR.
Dr. Amy? Okay, great.
Hi, everyone. Dr. Amy Stevenson, I'm actually a nurse case manager by my background, and I'm leading the justice involved implementation across Kaiser's 32 counties and with CDCR. So we wanted to talk to you guys a little bit about what's happening regarding that JI ECM population of focus, and talk about what's happening with the managed care plans and at the county side in preparation for this, and then also talk about what's live now and what's going to be coming live in the future. GI is a little complicated in the way that the state is rolling out, and hopefully this will help dismay some of that confusion. So first, the justice involved implementation really aims to connect the eligible members who back into the community. And this is to offer them 90 days of case management prior to their release. So this is happening while they are still in custody, whether they are adults in the state prison systems, the local sheriff department, or juvenile halls. And this is really to help stabilize them and their conditions prior to them coming back to the community. And so we'll talk a little bit about what does that mean and how do we connect people into ECM. The key to keep in mind during this time, guys, is while they're in custody, they are not a managed Medi-Cal member. They don't have insurance through us. Okay? And so we're really trying to get people connected back into care prior to that release. And that's really what this whole Justice Involved Reentry initiative is about. So we're really here to ensure that all of those eligible members, while they're in custody, get enrolled in Medi-Cal, and that's happening at the correctional facility side. If they haven't been screening for them for Medi-Cal and helping them apply, they will start to do that now. Okay, and this is to provide targeted, Medi-Cal and all the health services to everyone that they need. They'll have a detailed health risk assessment. Care plan will be developed that will be looking at physical, behavioral health, social determinants of health. So some of those community supports that Asya mentioned, all of those will be done prior to their release. And then they'll be provided a warm handoff to one of our JI ECM providers. And these are justice involved providers who have previous experience working with the justice involved population of focus. So they'll be able to also screen and get information about the medications they're on. We can help schedule transportations for those doctor's appointments, all of that sorts of things. So kind of think about it like a discharge from a hospital, how that comes in and puts place, but now it's going to be a discharge plan from a correctional facility, which we're really excited to be establishing. And so we're also working across with us also with those referrals into those community supports, such as the ones that we know, like housing, potentially, the food support that many of our folks coming back from into reentry may need as well. Next slide. And so prior to what's been going on, what the managed cares have been working on since January of this year, the justice involved was an ECM population of focus, but really this applies for people who are already back in the community. They've already been released. Their Medi-Cal and their managed care plan has already been reactivated. They simply qualify for the ECM programs, and those can be referred now, and we'll be talking about that. And so this is what we've been working on since this January of last year is to really collaborate with our ECM provider network, with our other managed care plans, so that our community-based JI providers are contracted with all the managed care plans in the county. We've been also working with our community-based referrals as regarding these pre-release services that we're calling them. And we also needed to update and maintain our managed care plan provider directory. These are available on our websites, so that people can see who our JI providers are. Anyone can look them up and find out who we're contracted with. We also have a designated JI liaison. That information is also published on all of our managed care plan sites. And this is a specialist who is there to liaison between the managed care plans and the corrections. Right. So some of this planning work that's been going on is in collaboration also with our county partners, of course. We cannot do this alone, even as our managed care plans. We must work closely with county sheriff, probation, as well as county behavioral health, and then statewide with the California Department of Corrections and Rehabilitation. So we have been working on aligning those roles and responsibilities across all those organizations, develop the infrastructure, aligning workflows to sort of, support that pre-release and care coordination, and really test out these workflows. This has never been done before, guys. We are the first state in the nation to actually institute this program. Other states are following in our footsteps, but we're really breaking ground here. And this is the first time that the correctional facilities have been exchanging and working collaboratively with the managed care plans. So this is all new grounds, and we have to build all of that infrastructure that takes. And a large portion of that is data sharing, as been mentioned earlier. So we need to execute a data sharing agreement, as well as there's going to be a statewide memorandum of understanding. All you need to know, those are legal documents we need to have in place to exchange data and align on what data will be exchanged and how are we going to do that. And then, of course, complete any of the IT infrastructure builds that are needed in order to exchange that data. Slide. So prior to the pre-release, so what's live now? So the CDCR, the state prisons, went live as of February of this year. So they are releasing adults out of their, I think there's 33 different state facilities, and they can release them anywhere back to the state. Because they're often incarcerated in different parts of the state. So they could very well be coming back to your county. And so you may see folks coming back from the CDCR prison system and being repatriated back into the county. We also have our counties are going live statewide in a staggered phased out way. They have between October of last year through October of 2026 to choose their go live date. We did put a link there. That's a link to the DHCS, the statewide readiness list of counties. They do have to submit and go through a readiness assessment and get approved by the state. Sheriff can go live at a different time than the probation department. So it really is up to each state or each county, when they go live. And as of right now, this county isn't live yet with the county releases. So the sheriff and probation are not actively participating in this pre-release work. We're still in the planning process for its implementation. So we're going to be working with them as to the ECM services that are available. What is available, though, are those post-release folks, those people who are back in the community already. So we're working with the county, though, in preparation for this launch to solidify those referral pathways, really education on both sides, managed care plans, the correctional facility sides, our providers, what do they need, like clearance to go into these facilities in order to meet these folks as part of the warm handoff. All of these fine-tuning of these workflows and processes are underway here in the county, and you'll be learning more about these in the future. Next slide. So finally, I just wanted to end on, sort of what's live now and what's coming in the future. So now, like I said, those ECM services for JI, those people who are post-release, they have their Medi-Cal turned on in their managed care plan. We can take those referrals now. If you come across those members, please send them our way. We've included our referral forms to each of our managed care plans, how you can send them. Members can refer, family members can refer. We really have a no wrong door policy in the referrals that we receive for our ECM and even community support services. Upon the go live of the county here, Then we will be implementing the correctional facility to manage care plan process to identify those members who are eligible for those pre-release services, that 90 days of case management prior to release. We're going to operationalize that data sharing strategy for the referrals. And then the pre-release also allows us to do presumptive eligibility for those folks who are in custody prior to their release. And that will help coordinate those warm handoffs with the ECM providers before their release. So that's sort of trying to give you a picture of now and in the expansion in the near future.